Good afternoon, everyone, and welcome to today's wonderful evening with Dr. Murli Bharadwaj. Finally, the time to put your nomination has come. Elections come once in 5 years, but NEETPG election comes every year. So the next 65 days is going to be 60 days, possibly. Time is a very fictitious character. Some say it doesn't exist, but at least as humans, mortals, we need to believe in the transgression of the time. So every day we have a test, 200 questions, absolutely what examiner want. Next 60 grand tests you should take seriously, attend every day, identify where you are, need to fill the gaps. Just to take one small paper and then write some things that you hate to remember, but you can't afford to forget, and then just post it in the group so that it's a way by which today studies is all not a isolated effort. It's a team effort, right? So with that preamble, let's make the great beginning. Very happy to see 6 online classmates. So what is this papillae which is being labeled A in the tongue? So it is the circumvallate papillae. So these are the foliate papillae, these are the fungiform papillae in the tongue. So there are four types of lingual papillae: filiform, fungiform, foliate, circumvallate. All of them except the filiform papillae, they have the taste buds. Filiform don't have. All except the circumvallate are innervated by chorda tympani for taste and lingual for sensory. And circumvallate papillae, they are innervated by glossopharyngeal, both for the taste and general sensation. Foliate papillae are the ones which are least developed in humans. And taste buds are numerous in all types of papillae except filiform papillae along the lateral aspects is what you have to basically remember. A little bit of taste of the examiner you need to be sure about. 30-year-old, diminishing vision, right half of both the eyes. It is the left optic tract. Now, one visual field defect, there is no paper. Patient presented with history of vision loss, aneurysm was identified causing the compression of optic chiasma. It is the anterior communicating artery which is very close. Patient undergoes submandibular gland excision and Wharton's duct was ligated in the process. So it is the lingual nerve most likely to be damaged. The submandibular duct emerges from the medial side of the deep part of the gland. It passes forward to open into the summit of the papillae. Lingual nerve loops around the submandibular duct. That's what you need to remember. A patient was admitted with a skull base, difficulty in swallowing. So, what is this structure? Gag reflex. Vagus. Very good. Gag reflex is for testing of vagus. Vertical and downward descent of the spleen is prevented by. So, when spleen enlarges, it enlarges towards the right iliac fossa because of phrenicocholic ligament between diaphragm and the colon. And sodium 10, potassium 140, chloride is 15 and bicarb is 12. It is intracellular fluid, not interstitial. So once more, obviously potassium is the predominant intracellular cation. Sodium is predominant extracellular cation. Plasma belongs to extracellular fluid. Tetany will result from respiratory alkalosis when you are hyperventilating. Large A wave on the JVP with mid-diastolic murmur. Correct, Vida. Pedal edema is a sign of right ventricular, right heart failure. No, that is the reason it is TS. మరి చూడాలి అన్ని చూస్తేనే మేము పీడియాట్రిక్ సీట్ ఇస్తాం ఉత్తగిస్తామా Now, neurological examination of a patient shows diplopia, suspected involvement of other cranial nerves, tingling, numbness in the lower extremities. Symptoms are getting worse upon taking hot bath. So, what is the diagnosis first of all? Simple. Symptoms were getting worse upon hot bath. Tingling, numbness, diplopia. It can't be explained by a lesion in one location but multiple locations. So, with neurology చదవాలి బిడ్డ Neurology, like multiple sclerosis, so classical, doctor. What are you talking? Lermit's phenomena, electrical sensation when bending forward, abnormality of the gait, diplopia because of the optic neuritis. So it is a demyelinating disorder. Demyelination is because of oligodendrocytes. ఓకే కొంచెం ఇవాళ చదవండి మళ్ళీ నెక్స్ట్ ఇంకొకసారి మల్టిపుల్ స్క్లెరోసిస్ మీరు తప్పు చేస్తే ఉరుకునే లేదు స్టాండ్ ఆన్ ద బెంచ్ నౌ ఏ పర్సన్ హ్యాస్ మీల్ at 8 p.m. records blood glucose at 7 a.m. on the next day, which is 180. What is the source of the glucose? Hepatic glycogenolysis. So you should know different times in starvation cycle. First, initially, who will give later, when will ketone bodies will come, everything is there. No feeding, starvation, cycle. Definitely one question will come. A patient with HNPCC, what is the most common repair associated? It is the mismatch repair. Pyruvate to acetyl-CoA. Pyruvate dehydrogenase and dihydrolipoyl transacetylase. For the oxidative phosphorylation of the pyruvate by pyruvate dehydrogenase, lipoic acid is joined by amide link to a lysine residue of the transacetylase component. Rosastadi. Examiner has no choice. 100% strike rate from Murli Bharadwaj. Mock test. Because 200 come from hardly 500 topics. Knowing these 500 topics into 10 points, 5,000 points is all that you need to know. But I gave you 1,200 pages notes, 50,000 high yield facts, discussed in about 600 hours video. ఇంత ఇచ్చినాక మీరు 5,000 పాయింట్లు ఆన్సర్ చేయకుంటే ఎట్లా సో డర్మటైటిస్ డిమెన్షియా ఇస్ ఆల్ నియాసిన్ సిస్టోథియోన్ బీటా సింథేస్ డిఫెక్ట్ సిస్టీన్ serum cholesterol 398, LDL is 220 where what is the diagnosis in this patient? Xanthomas are there, familial hypercholesterolemias. I told you now one question on hyperlipidemias, one question on lipoproteins. If not hypolipidemic drugs, Jarur aega. Now, doctor, very good to see 8 online classmates. रोज मिलेंगे रोज पढ़ेंगे एक दिन कामयाब होके दिखाएंगे दुनिया को. So patient presented with weakness, anemia, bony pain, hepatosplenomegaly. Which enzyme is deficient? Glucocerebrosidase. All this sphingolipidosis, mucopolysaccharidosis, everything you should, doctor. Cornea epithelium transparent means what? And cornea opaque ante hurler. Transparent ante hunter. Hunter, what is the mode of transmission? X-linked. Whom do we hunt, doctor? Opposite sex. लड़कियों को पढ़ाने के लिए पहला आंख तो दिखना चाहिए ना. तो clear cornea is a feature of hunter who is hunting. It is X-linked. Cornea is clouded in hurler, so he is hurling the objects. Easy way to remember. Some stupid way to remember. So, ఇక మీకు హంటర్లో ఎక్స్-లింక్డ్ అని తెలియకుంటే అందులో కెరటానా హెపరానా ఎక్కడ తెలుస్తుంది డాక్టర్? కెరటాన్ సల్ఫేట్. Which vitamin deficiency is this? Niacin deficiency leading to pellagra. 25-year-old with dark urine which blackens on exposure is dihydroxyphenyl acetate dioxygenase. So all this alkaptonuria, phenylketonuria, cystinuria, maple syrup urine disease, ఇవన్నీ కూడా హై yield టాపిక్లు డాక్టర్. ఒక్కదాని మీద 10 పాయింట్లు ఉంటాయి, అంతకంటే ఉండయి. हार्डली आपको 10 पॉइंट रहता है इसके ऊपर. In a isolated mitochondria in a medium containing succinate, fumarate, ATP were produced. Later a compound was added and that led to decreased oxidative phosphorylation. So what is that compound? It is oligomycin. I told no electron transport chain inhibitor. Chadavunri, saru. So please do revise electron transport chain. I'll give you 60 more occasions. 60 more times I will be available alive to remind you. बाद में आपका मर्जी. Right? So night blindness history, corneal drying, Bitot spots, typically associated with phrinoderma. 4-year-old boy, developmental delay, recurrent chest infection, worsening bony pain, PTH is normal, calcium normal, phosphate is low. Phosphate is low. No response to vitamin D. So it is called vitamin D dependent rickets. But PTH is normal. So vitamin D receptor level resistance, where will you have, doctor? Vitamin D should go and act on dependent कब होता? ये vitamin D deficiency है तो यहाँ vitamin D होने के बाद भी receptors are not responding, no? So where are you dependent? Correct? Correct or not? Even after having wife, you have to eat in hotel means, where is the dependence? The only way to keep a husband or a husband keeping a wife, one thing, Kaushik, do you know cooking? You know? Huh? A guy who knows cooking will save the marriage. Because if the wife is angry, you can nicely cook, put it under the moonlight, and then sing a song so that she will come back. Right? So, vitamin D dependence means dependence. नहीं है, यहाँ तो receptor level resistance है. That is X-linked hypophosphatemic rickets. I told you, the only condition which is X-linked dominant कौन होता है? Generally X-linked recessive, autosomal dominant, which is the only X-linked dominant. X-linked hypophosphatemic rickets is dominant, is what you need to basically remember. Very good to see 9 online. Multiple times loose stools managed with ORS. Glucose is absorbed through which receptor? SGLT1. SGLT1. So all the diabetic drugs, you have to be 100% sure, doctor. Patient with squamous cell carcinoma of lung has undergone pulmonary pneumonectomy. And this is the histology. What you see here, a lot of black pigment, anthraconotic pigment, which is typical of anthracosis, coal workers pneumonia. Chronic alcohol, increasing abdominal girth, decreased liver span. Liver biopsy is showing these inclusions. What are they? Mallory bodies in alcoholic liver disease. They are formed from intermediate filaments, is what you should remember. 56-year-old is working in benzene factory. He got retired 5 years before. What is the complication of benzene, doctor? Blood cancer, leukemia. 30-year-old on pap smear, disorganized growth, hyperchromatic nuclei. So dysplasia versus metaplasia. Metaplasia means one mature cell replacing another mature. Dysplasia is precancerous. Barrett's is an example of metaplasia. Cervical dysplasia. Right? For a period of time, if you ignore Barrett, then it becomes dysplastic, then it become adenocarcinoma. A patient with iron deficiency, what is accept? TIBC increase, then uh, transferrin receptors increase, RBC, protoporphyrin increase. Because if there is no iron, if the iron incorporates into protoporphyrin, it becomes porphyrin. If iron is not there, protoporphyrin cannot become porphyrin. So protoporphyrin increases. But transferrin saturation is decreased. Once more, I told you, IDA versus sideroblastic anemia, thalassemia, एनीमिया ऑफ क्रॉनिक डिसीज. एक क्वेश्चन नहीं है तो मेरा नाम मुरली भरद्वाज नहीं, जरूर आएगा कल के नीट पीजी में. 12-year-old patient with history of recurrent infection with the bleeding gum. Peripheral smear shows macrocytes. What do you see here? You see fatty bone marrow, which is a plastic anemia. Now, doctor, patient has been eating junk food, preparing for NEETPG in Vasant Vihar, Padmarao Nagar. So that is the reason our Girija said, hey, कौन रहते हैं सर हैदराबाद में, हैप्पीली घर में बैठे तो अच्छा सो सकते, अच्छा खा सकते, अच्छा पढ़ सकते. Right? One way that is right. Because first thing is, if you sleep well, the next 60 days, doctor, remember, 60 days is not just about knowledge. Next 60 days is all about stability of mind, agility of thought, brings you the ability to crack the NEETPG. So, मन को मंदिर बना के next 60 days को, every day morning when you wake up, think, God created you to become something great. You are on this mission, and this is the last NEETPG that is going to happen in your life. That's what you think and prepare. And think, if not me, who else can, how can others can get in top 100? Because you all had been laboring for the past 30 days, 40 days, 50 days, whatever it is, doesn't matter. Whole preparation is about not more than 90 days. Remember that. You ask any topper, 90 days जो अच्छा पढ़ता है उसको सीट मिलता. पूरा जिंदगी नेक आदमी होने का जरूरत नहीं है. मरने के पहले 10 दिन है तो भी स्वर्गलोक का डोर्स ओपन हो जाएगा. Right? So forget about past, worry it, and then enjoy the preparation. A patient has been eating junk food is obviously MCV more than 125 ante folate. 20-year-old female presented with the features which is being shown below. Webbed neck and lymphedema. So Turner. So what do you expect? Streak ovaries. Rheumatic heart disease undergone biopsy is Ashkoff body. 55-year-old diagnosed with multiple myeloma came for follow-up. What is the most important prognostic factor in multiple myeloma? Beta 2 microglobulin is the most important. This thing. Once more, मैं क्या बोला आपको? भैया multiple myeloma पढ़ो, भैया Waldenstrom's macroglobulinemia पढ़ना. MGUS, monoclonal gammopathy of unknown significance, or heavy chain disease. उसका definitions क्या होता है? Everything, anything about multiple myeloma. The other day, what was the question? Rulex formation is there. Albumin globulin reversal of ratio is there. High ESR is there. Bone pains are there. Anemia is there. Elderly female came to you. Her alkaline phosphatase is normal. Radionuclide scan is negative because there is no osteoblastic activity in multiple myeloma. Everything you need to revise, doctor. Can the online students can punch whether the voice is loud and clear for all of you, doctor? I'm so happy you all came, and every day, next to 60 days, please download the Score app, and after this discussion is over, we will upload the video, PowerPoint, everything into the Score app. And in the Score app, every day morning when you wake up, a new test become visible, and then it will be just like the NEETPG. So this is the 16th test, 16th test, 15th test, another 60 tests. So totally almost 70-75 tests we give you. ये 70-75 टेस्ट में आप लगभग 15,000 एमसीक्यूज का डिस्कशन भी सुन लेते हैं सॉल्व करने के बाद. अल्टीमेटली आने वाला 200 क्वेश्चन ये 15,000 क्वेश्चन बैंक से ही मिलेगा. So preparation for NEETPG is just a game, last 90-day game, that's all, right? So please do come every day, be part of our WhatsApp study group, and we keep uploading you every time the discussion begins. A patient with lymphoma, with BCL2 marker, CD10. So what is this? Follicular architecture. So it is a follicular lymphoma. So different types of Hodgkin, non-Hodgkin lymphoma, how to identify diffuse lymphoma, how to identify follicular nodular sclerosing type, mycosis fungoides, everything you should read. Lymphoma, lymphoma, lymphoma. One question aega. Male patient with splenomegaly shows following bone marrow. So what do you see in bone marrow? Myeloblasts, which is typical of myeloid leukemia. So that's the reason you need to do PCR and FISH. Myeloid hyperplasia is being shown. So CML is mainly the disease of adults. And the first symptom is all the dragging sensation in the abdomen because of the splenomegaly. 25-year-old man presenting with palpable purpura, bilateral knee joint involvement, and RBC and proteinuria. Urine analysis. So arthritis, palpable purpurae, abdominal pain. Why abdominal pain will be there in Henoch's colon? It is a vasculitis, vasculitic purpura. It involves mesenteric vessels. मैं इसके पहले भी बोला ना. So abdominal pain रहेगा, arthritis रहेगा. And what type? It is the other end of the spectrum of IgA nephropathy, HSP. IgA nephropathy lead to recurrent benign hematuria. And what type of hematuria? Sympharyngitic hematuria. Today sore throat, and within 48 hours you get hematuria in Henoch's colon purpura. Unlike in case of post-streptococcal glomerulonephritis, it takes 3 weeks between sore throat and hematuria. So, और एक बार vasculitis, vasculitis, vasculitis. एक small vessel, large vessel, medium vessel. Kawasaki is the medium vessel. Large vessel is Takayasu arthritis-like condition. Giant cell arthritis. Small vessel is Henoch's colon purpura. Similarly, Churg-Strauss, Wegener's granulomatosis, polyarthritis nodosa, microscopic polyangiitis, cryoglobulinemias. मेरे प्यारे भारतवासियों, इसको छोड़ना नहीं, पढ़ के जाना कल के एग्जाम को, ठीक है? Then comes radical cystoprostatectomy was done. What do you see here? It is all transitional epithelium. So bladder cancer. Indian medical intern, which is the correct format of prescription of alprazolam. Tablet alprazolam 0.5 milligram once a day before bedtime for 7 days. So prescription writing is very important, doctor. So superscription includes date of the prescription, name, address, weight, and age of the patient, etc., etc. So be very sure, because a good doctor is equal to good prescription. हम बहुत खुश हैं, एकदम 13 students online, very good. So I have no other job. Let me tell you very clearly. आपको अच्छे लगे या नहीं लगे, हमको तो दूसरा काम कुछ भी नहीं है. नेक्स्ट 60 days आपके साथ बैठ के रोज एक टेस्ट लेना, टेस्ट डिस्कशन करना. ठीक है? तो ऑलरेडी आई फिनिश्ड an ad physio, biochem, micropharma, path, forensic, ENT, orthoped. Ped is not done. Ped they will do. Right? So everything पढ़ के score app में you have 50,000 high yield facts, 1200 pages notes is available. Even that notes is there like individual flashcards on the score app. So please take every opportunity to download, subscribe to the score app today only. Right, doctor? Now, this is another very standard question, doctor, you need to know. मैं पहले भी आपको बोला, एग्जामिनर एक प्रश्न पूछेगा. क्या पूछेगा? हाफ लाइफ, वॉल्यूम ऑफ डिस्ट्रीब्यूशन, bioavailability, first order kinetics, zero order kinetics, and steady state concentration of the drugs. Without that, there is no NEETPG exam at all. So what is the dosing rate? Dosing rate is clearance into target plasma concentration. Clearance rate denominator lo time untadi doctor. Amount cleared by in unit time. Rate also denominator mein kya hai? Time. So target plasma concentration into clearance will give you dosing rate. Once more, what is loading dose dependent on? Is it dependent on bioavailability, or is it dependent on the half-life, or is it dependent on what factors? Similarly, maintenance dose is dependent on what of these pharmacokinetic parameters. So, मैंने pharmacology में 5 pages दिया, 50 paragraphs में पूरा खेल खत्म, दुकान बंद, खत्म कर दिया पूरा फार्माकोकाइनेटिक पैरामीटर्स. सो मेरे प्यारे साथियों, जरा स्कोर ऐप में जाके फिर रिवीजन करना. द पेशेंट विद ब्रोंकियल आस्थमा विद राइज इंट्राओक्युलर प्रेशर. सो व्हाट इज द ट्रीटमेंट ऑफ ओपन एंगल ग्लाकोमा? Letanoprost. 45-year-old is being treated with low dose aspirin. Aspirin presented with rectal bleeding. How does aspirin act? Basically, it is the thromboxane, right? Once more, what is the dictum? Antiplatelet agents, antithrombotics, thrombolytics, within antithrombotics, direct thrombin inhibitors. In that, what are oral, what are parenteral, and what are the drugs used if there is excessive amount of them and leading to bleeding? What monoclonal antibody is used? अम्मो, ये पूरा चीजें 2 pages में, आपके 1200 pages notes में 2 pages में मैंने दे दिया. रिवीजन करना आपका फर्ज है. फर्ज या जिम्मेदारी, क्या बोलते बेटे? योर रेस्पॉन्सिबिलिटी को क्या बोलते हैं? जिम्मेदारी या आपका जिम्मेदारी. फर्ज बोले तो राइट है, फर्ज इज ड्यूटी. मैं अपना फर्ज निभाया पढ़ाने का, आप आपका रिविजन करने का जिम्मेदारी खत्म करो. तो 34-week pregnant female with polyhydramnios presents with labor pain. She was treated with indomethacin. What will happen? Always remember P, 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 P. P means P maintains patent PDA. Prostaglandins cause patent ductus arteriosus become patent. And any antiprostaglandin will cause premature closure. 60-year-old female with renal disease with pyelolithotomy. What is the post-operative analgesic of choice? Acetaminophen. 45-year-old presented with symptoms which are being shown in the image below. There is a development of what? Angioedema. So she is on hypertension. Which antihypertensive lead to angioedema? Lisinopril. Perfect. तो कीलजुमैब एक ऐब के बिना नीट पीजी हुआ तो मोदी जी कैंसिल करेगा उस एग्जामिनर को. नेक्स्ट टाइम चांस नहीं देता क्योंकि एक ऐब होना ही पड़ेगा. वेदर यूएसएमएल गए या नीट पीजी को गए, कहीं भी गो. सो डॉक्टर, व्हाट इज दैट? इंटरलूकिन 6 इज तोकल लेनी abu, tocilizumab, right? Now you have given digoxin therapy. What do you see here? Digoxin toxicity. 1 ECG के कभी कभी 2 ECG के बिना एग्जामिनर सोएगा नहीं. So reverse mustache sign, Dali's, similarly check mark sign. All these things you have to be 100% sure when it comes to digoxin toxicity. So it is the clarithromycin which can lead to digoxin toxicity. And what is the ECG showing? Frequent PVCs. Frequent premature, when this is the normal QRS, doctor. This is a normal QRS. This is a abnormally shaped QRS. So it is called premature ventricular complexes. So you are having bigeminy with frequent PVCs. This is a PVC, this is a PVC. So which is the classical feature of digoxin toxicity? And what are the predisposing factors for digoxin toxicity, doctor? Quinidin, verapamil, diltiazem, captopril, propafenone, macrolide, amiodarone, anything can cause digoxin toxicity by inhibiting the P glycoprotein. मैं और एक बार आपको याद दिला रहा हूं, डॉक्टर, ट्राइसाइक्लिक एंटीडिप्रेसेंट, one question. Digoxin, number 2. Lithium, number 3. Amiodarone, number 4. ये चार द्वारपालक है वैकुंठ में नीट पीजी एग्जामिनर का. 1 क्वेश्चन जरूर आएगा. You need to do the revision, everything about them. Hypertensive patient presented with chronic renal insufficiency with fetal edema. Serum creatinine is 1.9. So which of the drugs should be used in this given case? 70. बताओ आपको मालूम है आंसर? Which always diuretic is great, doctor. Diuretic. So what is the desirable property of thiazide diuretic in antihypertensive? What is the specialty? Why thiazide diuretic? Once a day dosing, flat dose response curve, so that you can easily standardize the regime. No fluid retention, no tolerance, low incidence of postural hypertension. If you use prazosin, there will be postural hypertension. गिर जाएगा. हड्डी टूट जाएगा और मर जाएगा, all because of your progestin. Relative freedom from side effect, especially CNS compared to beta blockers. Effective in isolated systolic hypertension. Favorite question. Elderly man came with isolated systolic hypertension. What is the treatment of choice? Antihypertensive of choice. Thiazide. Thiazide. That is the JNC criteria. Joint National Committee for Hypertension Management ka criteria. 26-year-old female came with preconceptional counseling. Patient is a known hypertensive compliant to the drug therapy. Which drug will you advise to stop? Lisinopril. Lisinopril, absolute contraindication in pregnancy, ACE inhibitors. 36 weeks pregnant female was taking warfarin for prostatic heart valve. INR value is 3. What is the next step in management? Stop warfarin, start heparin. అది మంచి పట్టుకున్నారు. Heparin, warfarin, heparin. Very good. So good doctor, 40 minutes we finished 50 questions. क्या बात है? ई स्पीड ला चलवाले. कम से कम शताब्दी एक्सप्रेस का इतना स्पीड रहेगा. मगर शताब्दी एक्सप्रेस काम करना है तो पहला आप स्कोर ऐप में सुबह 10 बजे होते ही एक नया ग्रैंड टेस्ट आएगा, उसको सॉल्व करो स्कोर ऐप में, तब शताब्दी एक्सप्रेस आएगा डिस्कशन के लिए. नहीं तो गुड्स गाड़ी के जैसे लोह पदगामिनी बोले तो क्या है मालूम दीक्षा? लोह पदगामिनी. मेरा हमारा एक दोस्त है रायपुर में, परिचय चक्रवर्ती बोल के. हाँ साहब, आप चलोगे लोह पदगामिनी पे, चलोगे बिलासपुर में लेक्चर देने के लिए, रायपुर से बिलासपुर सेंटर में. भाई ये लोह पदगामिनी क्या है? लोह पद मीन्स रेल. व्हाट अ ब्यूटीफुल हिंदी है. सो हम लोह पदगामिनी के ऊपर जाने वाला गुड्स गाड़ी नहीं है, हम तो है शताब्दी एक्सप्रेस. इसके लिए पहले आप सॉल्व करके आओ, हम डिस्कस करके 2 घंटे में 200 क्वेश्चंस को बर्री करके लास्ट नेल इन द कॉफिन लगा के जाएंगे. और रोज आप 10 टॉपिक्स आइडेंटिफाई करो. वेयर एम आई गोइंग रॉन्ग, जस्ट उसका रिविजन करो. दैट्स ऑल. दैट इज द सीक्रेट ऑफ विनिंग. A female taking oral contraceptive acquired TB after prescribing antitubercular therapy, alternative contraception. Why? Because rifampicin increases the OCP metabolism. All P450 induces P450 inhibitors. ये दोनों को गर्मा गर्म पढ़ो मेरे साथियों, डेफिनेटली एक क्वेश्चन आएगा. Metronidazole is used for anaerobic infections, bacterial vaginosis. Metronidazole prescription should be avoided. Patient is instructed to avoid what? Obviously, metronidazole, alcohol, disulfiram. स्कूल जाते हुए बच्चे को पूछे तो भी आंसर करेगा इसको. So what are all the drugs that are to be avoided in disulfiram? Metronidazole, azole drugs, cefoperazone, cefamandole, cefotitan, procarbazine, chloropropamide, glimepiride, grisofulvin. This is the list you need to remember. 20-year-old with slow growing mass on the medial side of the thigh. There is an osteogenic sarcoma which was treated with methotrexate. How does methotrexate act? It inhibits dihydrofolate reductase. So we use leucovorin to overcome the toxicity. And what are the side effects methotrexate can cause? Mucositis, crystalluria, and bone marrow suppression. Hepatotoxicity, pneumonitis is what you need to remember. Then a child presented with abdominal pain, fever and blood in the stool, which enrichment media? Selenite F broth. So it looks very painful. You must remember all culture media. खेलते खेलते याद रखना. Where do you use Robertson cooked meat medium anaerobic infections? Where do you use Smith Nagauchi medium? Selenite broth. So totally 20 culture media doctor. खेलते खेलते पढ़ो और याद रखो. So patient admitted with 50% burns, develop infection of the burn site. The swab is cultured and the isolate is an obligate aerobe. Obligate aerobe. Oxygen के बिना survive नहीं होगा. Burn, wound homogenate, you added CHCl3 that led to development of a aqueous layer, Pseudomonas aeruginosa. అదే అన్నావు కదా, వెరీ గుడ్, వెరీ గుడ్, గట్టిగా అన్నా. నేను రోజు చొర్రుతూనే ఉన్నా కదా, ఇక నువ్వు స్టూడెంట్ అయితే ఒర్రకుంటే ఎట్లా వినిషక్క. Now HIV positive patient presented with fever, chills, productive cough. His CD4 count is less than 55. X-ray is shown. There is all interstitial pattern. Pneumocystis, జీరో వ్యక్తి. అదే వింటావా? ఇవన్నీ చిల్లర క్వశ్చన్లు ఎవళ్ళైనా పెడతారు, అందుకనే ఉన్నారు మీరు. ఇప్పుడు చేసినా ఇవన్నీ చిల్లర క్వశ్చన్లు. See, it's called dolphins training. What do you mean by dolphins training? A dolphin like Diksha will be disappointed if continuously every test if she is getting low score. So a dolphin trainer means what? If one test is tough, other test you need to decrease the ring height. So a dolphin can jump and next it will try higher ring. Am I right, Diksha? So a lot of people put mock tests. They unnecessarily make it too hard to show off their thing. But actually entrance is not that hard. Actual NEETPG entrance में almost 180 questions खेलते answer कर सकते. Just you need to go, where is my multiple sclerosis? Where is my multiple myeloma? Where is my lymphoma? Where is my leukemia? Where is my contraception? Where is my ovarian cancer? I say, you have to collect the pebbles on the beach of the sea. That happily you need to, like a small child going to the beach to play. You need to enjoy taking entrance. అంతేగాని చచ్చినప్పుడు నాయన లుకీమియా చదవలే అడిగిండు. No. You should not go with fear. You need to go with head held high with confidence. After all, what you need is not 3,000 pages medicine notes. Bakwas hai. In 120 pages, I gave medicine. Cardiology, neurology, nephrology, rheumatology, endocrinology, everything finished. Kel Kadan Dukan Band. So 1200 pages में पूरा 19 सब्जेक्ट्स का नोट्स मैंने दे दिया. स्कोर ऐप के ऊपर है. Shortly we are going to introduce a feature called search. आप Parkinsonism बोल के मारे तो all slides where Parkinsonism will come like a stack. All MCQs on Parkinsonism will come and stand as a stack. You can enjoy it. Unimmunized 2-year-old child presented with history of 4-day fever, coryza, conjunctivitis, white lesion on the buccal mucosa, maculopapular rash, copulic spots. Copulic spots are there in measles. Measles is paramyxovirus. Paramyxoviruses are single-stranded RNA viruses. A group of 20 friends had a late-night party. Next morning, one started to vomit, followed by another. They all eaten क्या खाते हैं भाई वो रहता है ना वाटर में पानी पानी पूरी हाँ so staphylococcus aureus enterotoxin child is presented with a history of pharyngitis swab was taken so where will you throw that swab yellow bag a bag तो हमको छोड़ेगा नहीं until we get into the bag right one colored bag तो छोड़ेगा नहीं उतना क्या लिख रहे हो बेटे ఇప్పుడు సేమ్ ఉందా లేదా patient is suspected of suffering brucellosis serial dilation of the serum the test comes out to be positive what is responsible for initial negative test it's called prozone phenomena so whenever you are doing an agglutination test it is the gold standard test against which all other serological tests are compared she is the younger sister in the family who is very bright and studies so well, goes to medical college, and we don't even qualify. Huh? So that is gold standard against which we are compared. It is a tube agglutination test. Whenever there is a tube agglutination test, equal volumes of serial dilution of the patient's sera are mixed with a smooth suspension of standard strain of Brucella abortus. So typically, in this you get the what you call prozone phenomena. So I leave the literature for you. Just एक बार revision करो. While shifting once more, agglutination tests, flocculation tests. What is Vidal? What is Kahn's test? And different tests of the syphilis like VDRL, etc. A area is very hot area for examiner. Sure shot, एक MCQ आएगा, आप revision करना पड़ेगा. Very nice to see Dinesh. Excellent Dinesh. Keep punching your answers, doctor. Be active. Like every day हम 3 घंटे में 200 क्वेश्चंस का रिवीजन करके घर जाएंगे. So keep punching your answers. While shifting a patient receiving an emergency blood transfusion, there is an accidental blood spill. How do you disinfect it? Sodium hypochlorite. Wedge-shaped perforations in hair shaft are seen in mentogrophytes. This we discussed Dharmagaram in dermatology. Dermatology, I gave 23 pages notes, doctor, dermatology. आप घर जाते ही एक बार रिवीजन करो. Those who are online, those who wanted the 1200 pages notes covering all 19 subjects to be couriered to you, please call our helpline. Now, hair perforation test is for trichophyton, mentagrophytes, and microsporum canis is what you need to remember. 35-year-old male comes to OPD with progressive swelling of the left thigh. And there is microfilaria. Cheppina nenu? Tokalo emundi. Tokalo nucleus unda. Tokalo nucleus lekapothe. దాన్ని ఏమంటారు వినిశక సో లోవా వ్యుకర్ ఏరియా ఇంకా మలయి ఇవన్నీ ఎలా డిఫరెన్షియేట్ చేస్తారు అధ్యక్ష దిస్ ఇస్ బ్యాక్గ్రఫ్టింగ్ The microfilaria have a sheath with no nucleus seen in the end of the tail. So, microfilaria larvae typically in lymphatics are bankruptcy malayi, subcutaneous are loba, onchocerca, manzanella. So, it is based upon the fact that microfilaria have a sheath with a no nucleus seen in the end of the tile makes it bankruptcy. If there are two nuclei, then it is Malay. Beautiful. Right? So the other day we discussed daily, every day one microfile area, my already lower katam, lower nai katam hua. Malay katam, bankruptcy katam, examiner next exam में lower पूछेगा. Now, patient on steroids on chronic urticaria for 2 years. He came to emergency with acute respiratory symptoms, nocturnal cough for last several weeks, bronchoscopy, BAL was done. And what is this that you see on the peripheral smear? Peripheral smear. And there also BAL is showing small larvae. ఇవేంటి డాక్టర్ గారు న్యూట్రోఫిల్లా మోనోసైటా ఇస్నోఫిల్లా దేసోఫిల్లా पेरिफेरल स्मीयर में these 5 tests करना. How to identify neutrophil, basophil, band forms, eosinophil, mast cell, metamyelocytes, left shift, everything. These 5-6 things, peripheral smear you need to know. Which is strongyloid circularis, where hemogram is showing marked amount of eosinophilia, is what you need to remember. Very good. A truck driver man with painless demarcated ulcer on the penis with inguinal lymphadenopathy. So, which type of microscopy is used to see the motility? Dark field microscopy. So, once more, doctor, what are the panchabhut of STD? Syphilis, granuloma inguinal, LGV, gonococcus, ఇంకా gonococcus, herpes simplex virus. మళ్ళీ అటు లేడీస్ సైడ్ తీసుకుంటే ఏముంటుంది? బ్యాక్టీరియల్ వెజనోసిస్, ట్రైకోమోనియోసిస్. ఎందులో సెక్షువల్ పార్ట్నర్ని ట్రీట్మెంట్ ఎందులో అక్కర్లేదు. జరూర్ ఆయేగా పడినా. A patient from UP presented with high-grade fever, with pallor, hepatosplenomegaly, pancytopenia, buffy coat show, macrophages laden with organisms which are showing kinetoplasts. Which vector? Kinetoplasts. Macrophages laden with kinetoplasts in the buffy coat. Leishmania. Sandfly. Right? Sandfly. There are 2 forms, emastigate, promastigate. Emastigate is in humans. Promastigate is in the sandfly. Emastigate form LD body is typically seen in leishmaniasis. Shall we take a quick 5-minute coffee break? Oh no, just 2 minutes. Voice break. So, welcome back to the session, Doctor. 25-year-old presented with urethral discharge after a unprotected intercourse. So, what is this discharge, Doctor? Purulent, thick, white discharge. Oh, thank you. మళ్ళీ ఇంకొక రౌండ్ తీసుకుంటా కాఫీ. So, what is this condition? Gonococcus, gonorrhea. Now, what is this incision, Doctor? Laceration. Incised looking laceration. It is also called split laceration. Splitting occurs by crushing the skin between two hard objects. They are called incised looking lacerations. Okay? Now, which of the following is true regarding this change? So, what is this change? Marbling of the skin. Marbling of the skin is because of sulfur hemoglobin. It starts in 24 hours but is prominent in 36 to 48 hours. While recording evidence in court of law, the lawyer asked the witness, did A killed B? Witness said yes. What is this question called? Leading question. Leading question. This type of leading question is permitted only in beautiful. మళ్ళీ అదే అడిగినాం మొన్న కూడా వచ్చింది కదా ఈ క్వశ్చన్ ఇది చెప్పండి MBBS में botany was the miserable subject to remember and recall. वो botany छोड़ेगा नहीं आपको NEETPG में भी. बोलो आयुर्वेदम डॉक्टर. It is called bilavanol. Bilavanol. Bilavanol is Semicardus anacardium, also called marking nut. Its juice is used by washerwomen as a marking ink on the cloth. Right? But it is fatal. Accidental poisoning may result from administration of the juice internally by the quacks for doing a septic abortion. So what is this phenomena due to? Washerwoman hand, which is maceration of the skin. The case of immersion in water for 36 hours will lead to this kind of appearance. A child was playing with a fruit and ate it and has irritability, not passing urine, agitated, constipation. It is datura, atropine. And see, not passing urine. Datura is what? Atropine. Atropine is anticholinergic. Cholinergic make your bladder piss. If anticholinergic is given, urinary retention is there. Man is working in fields, collapsed in hot summer afternoon. So, he is a case of heat stroke. Heat stroke में sweating नहीं होता है. So, heat stroke, heat shock, all these heat, three conditions है ना. So, उसको why they are, how are they different, वो सब पढ़ना है. A guy was sitting in the balcony overlooking park. He was sitting naked for sexual gratification. Exhibitionism. वो तो अंग्रेजी मालूम है तो ये मालूम होता. Right? Then, of course, in some countries, nude beaches are permitted now. But there it is not exhibition. But in India, it is legal. Right? Yeah, a lot of dogs will be there. Woman gave birth to twins. The father thought the children does not belong to him. DNA fingerprinting was done. He found that one child belonged to him. After becoming pregnant, once more becoming pregnant, is generally one pregnant. First pregnant is because of the regular husband, other is because of the pati patni or oh, right? So that is a case of super fecundation. Superfetation means fertilization of ovum from a second subsequent ovulation of a woman who is already pregnant. Fetation means. And superfecundation means multiple pregnancy from the fertilization of two or more ova liberated in the same menstrual cycle by the spermatozoa introduced by successive acts of coitus. That's the whole problem. Right? So the husband found that one baby is very smart. He felt that I was never this much smart. How come this baby is born? Then the husband said, "No, no, it was through my classmate, and this is through you." So now, not suggestive of cocaine poisoning, bradycardia, agitation, hypothermia, myocardial infarction. All of them can occur with cocaine poison, but the pulse will be rapid. Tachy will be there, not brady. So all these substances of abuse है ना डॉक्टर, बोथ साइकेट्री में यही बात है और फॉरेंसिक में भी यही मामला है. सो जहां दो मामले होते हैं, श्योर एग्जामिनर छोड़ेगा नहीं. Like TB comes everywhere. So if the TB doesn't come in NEETPG paper, examiner will be banned. 20-year-old male complains of gradual swelling around the wrist for 3 months. What is this soap bubble appearance? Where do you see, doctor? Genital tumor. Then 20-year-old, once more, one question on bone tumor. Compulsory. Okatemo osteomyelitis. Lelo, avascular necrosis of femur. A question. Congenital dislocation of hip one. Congenital talipes equinovarus one. You can count on fingers. हर एक 4 to 5 hours में the moment you are able to do revision of for NEETPG na end to end of one subject, that day you are ready for the game. Okay. So for example, orthopedics I have given you 52 pages notes. ये 52 pages को अगर आप 5 घंटे में रिवीजन कर पाए तो every time you decided, that day you are the winner. Like that all 19 subjects, right? 20-year-old, low back pain, early morning stiffness, bilateral heel pain. What is the diagnosis? Ankylosing spondylitis. Backache, morning stiffness, X-ray of the patient is shown. What do you have? Bamboo spine. That's the reason it is ankylosing spondylitis. Postmenopausal women with Colles fracture. Teriparatide should be given before supplementing biphosphonates, one at a time. Calcium requirement is 1200. Oral vitamin D3 can be given along with oral calcium. They're all true statements. Once more, what is the only drug which is both blastic and, bone forming and stops resorption is? You said strontium? Good, very good. Strontium is the only one which will cause newborn formation and also prevent resorption. Otherwise, drugs are divided into, osteoporotic drugs are divided into inhibitors of resorption or stimulants of osteogenesis. वंस मोर, आप एक बार ऑस्टियोपोरोसिस टॉपिक को मार्क करके उसके ऊपर व्हाइट पेपर लेना. 10-year-old with normal bone mineral density, X-ray is being shown to you. What do you have? This is the Pelkan spur, which is seen with scurvy, sclerosed margin of the epiphysis. So rickets to scurvy, both radiological features 100% mutti mere na. A patient fell riding the bicycle, started having pain, shortness of limb is there. What is this? Flexion, adduction, internal rotation, fatigue, posture dislocation. What is this test? Pen test, which is typically done in median nerve. So, patient tries to touch the pen by abduction of the thumb, and the examiner feels abductor pollicis brevis at the wrist. If the patient fails to touch, then there is abductor pollicis brevis paralysis, which is supplied by median nerve. A patient presenting with multiple humeral shaft fracture has a difficulty in flexion of elbow and supination of the forearm. Abba, beautiful question. My favorite question. Chapati. बच्चों एल्बो को फ्लेक्स करो अभी सुपेनेशन करो सुपर you feel your biceps flex your elbow बराबर supination करो supination means soup palm faces the roof supination करो ए biceps hold करके biceps क्या हो रहे हैं कंट्रैक्ट हो रहे हैं ना biceps is contracting no every time you are supinating. So biceps is the supinator when you flex the elbow. अभी extend करो अभी supinate करो biceps में कुछ हो रहा है क्या कुछ भी नहीं होता पूरा extend करके करे तो then it is supinator muscle. Supinator muscle is supplied by radial nerve, whereas biceps is supplied by musculocutaneous nerve. Biceps is the main supinator when you flex the elbow. Supinator is the main supinator when you extend the elbow. So you had a difficulty in flexion elbow and supination of the forearm. So that is the reason it is musculocutaneous and biceps brachii. Barabar? So this is one of the favorite questions of the examiner. 24-year-old man, history of intermittent evening rise of temperature with the weight loss presented with the flexion deformity of the right hip. Flexion deformity of the right hip. So obviously flexion of the right hip is done by what? Psoas. So which is the muscle? Psoas, which is marked 4. So this is tensor fasciolate, this is psoas, this is iliacus, this is adductor brevis, adductor magnus, adductor and iliotibial band. So all these things need to be good. 15-year-old with myopic astigmatism refuses to wear the glasses. So what do you want to give? Spherical equivalent glasses. So patients above the 20 years age, stable refraction for at least 12 months, motivated patient, they are the ones who require good for refractive surgery. If there is absence of corneal pathology, presence of ectasia, and a corneal thickness less than 450 is an absolute contraindication for LASIK surgery. Whitish pupillary reflex means what? Retinoblastoma. Retinoblastoma may what? Winter-Steiner rosettes, which is the feature of retinoblastoma. Once more, ophthalmology में cataract, glaucoma, retinoblastoma, retinitis pigmentosa. One question on strabismus, one on visual field defects. Like that you can count. You can count. One question on amblyopia. So please go by pattern instead of First page to last page of Qurana textbook. Anyway, you won't read, I know that. Because you passed MBBS not by reading all that, no. You never know, no. What is retinitis pigmentosa until I told you now. What is Diksha? At least do revision. Where do you find bony spicule appearance of retina? Retinitis pigmentosa. Vitreous hemorrhage lead to which type of retinal detachment? Fractional retinal detachment. So आज ही जाके आप 52 पेजेस नोट्स मैंने दिया, जरा पढ़ो मेरे साथियों और मुझे खुश करो. Next tomorrow, every day we have the grand test. So 1 month-old baby comes with watering of the eyes and cloudy cornea is ophthalmos, congenital glaucoma. A female with 2-year history of contact lens. Huh? Watering eyes, discharge kaadu, watering eyes, epiphora, and a cloudy cornea. ఇప్పుడు తెలిసింది కదా. Eye pain, irritation, foreign body sensation. Contact lens में what is the complication? Giant papillary conjunctivitis. Elderly female with gradual painless vision loss. Fundus is being shown. What is this called? Hard exudate. So hard exudate is a feature of diabetes. And patient presenting with diminished vision in the dim light, with dry eyes and roughening of corneal surface. Which deficiency is this? Retinoic acid. तो विटामिन ए डेफिशिएंसी का क्या पूछ रहा है? विटामिन जीरोफ्थैल्मिया के बारे में पूछ रहा है, नाइट ब्लाइंडनेस के बारे में पूछ रहा है. ये भी क्वेश्चन है क्या? A patient presented, what is this called? Coloboma. So it can lead to exposure keratitis. Roomy nasal cavity, foul smelling, yellow discharge. Atrophic rhinitis, ozena. Topical application of 400 micrograms mitomycin is used for subglottic stenosis. Another very standard question. 9-year-old male brought to emergency, difficulty in swallowing, X-ray was taken. You have a coin. You have a coin. अभी टेंशन क्या है? ये ईसोफेगस में है या ट्रेकिया में है? ट्रेकिया में है या ईसोफेगस में है? Is how if you take the when foreign body lodged in esophagus, the flat surface of the object is seen in the AP view and the edge is seen in the lateral view. If it is esophagus, if you see flat, this in the lateral view and edge in the AP view, then that is trachea. Clear? You see, full coin ऐसा दिखाया in the AP view and edge is seen in the PA view, in the lateral view. Then this is esophagus. Correct? But if you see it, if it is trachea, then here you see it like this. And in the lateral view, it will be seen full opposite. Put it there. अगर ये नहीं अभी मालूम नहीं है तो I mean to say prenatally. इंट्रापार्टम डायग्नोसिस बोल के रहता है. एग्जाम में जाके सोचना ये क्या होगा. कम ऑन शेरलॉक होम्स. एग्जाम टुमारो नीट पीजी 1 hour में खत्म करना पूरा. 3.5 hours इज टू मच. अव्वा 3.5 hours अगर आप ले रहे हैं बोले तो सीट नहीं आ रहे. दैट इटसेल्फ इज अ डिक्लेरेशन. 1 hour में you should finish all 200 questions. So if you solve 600 so Sayantani Paul is asking, sir, which mock test discussion is this? Score app स्कोर नीट पीजी ऐप टाइप करो डॉक्टर, नीट पीजी ऐप, and call 900868 Very good. I'm so happy. 22 students on this thing. So once more, Sayantani, Paul, and everybody, 70 full-scale grant tests. Every day one grant test, exactly like the exam. And more important, आपको grant test कहीं जगह पे मिलेगा, मगर only on the Score NEET PG app. Every day, unemployed MD General Medicine called Murli Bharadwaj will be available to do the discussion. Also, you become part of the WhatsApp study group. And also on the Score app, you have 1200 pages notes and 600 hours video content and 40,000 MCQs as a subject test question bank. They're all available, right? Dinesh is asking, can we give this test before discussion? Definitely. Please download Score NEET PG app, right? It is available both in iOS and Android. So every day morning 10 o'clock होते ही नया टेस्ट पब्लिश हो जाएगा और दोपहर में परम सन्यासी मुरली भरद्वाज आके आपको पूरा 200 क्वेश्चंस का डिस्कशन करेगा, आपको प्रेडिक्टिव रैंक मिलेगा, ये पूरा पावर पॉइंट वीडियो लेक्चर, एवरीथिंग इज आल्सो मेड अवेलेबल बाय लेट इवनिंग. सो दैट इज हाउ यू बिकम बेटर. सो आप कहीं भी कोचिंग लो, कोई बात नहीं, मगर लास्ट 70 ग्रांड टेस्ट, डेली ग्रांड टेस्ट मुरली भरद्वाज का लिए तो, डिस्कशन लिए तो, फिलअप करे तो द गैप्स, invariably you will get the top rank. So please do call our helpline or WhatsApp and you will get the subscription 900868 So doctor, that is a little bit of advertisement, so which they don't teach in medical college. So 40-year-old female presented with nasal bleeding. Initial nasal packing was done, stopping of the bleeding is done. But once pack is removed, once more bleeding is there. Once more, what is the favorite question I told you? Definitely आएगा, epistaxis. कल का mock test, परसों का mock test, हर एक mock test में एक epistaxis का bleeding, ultrafs area posteriorly, littles area anteriorly. What constitutes these? Favorite question of the examiner. So endoscopic sphenopalatine artery ligation is considered to be the treatment. School health किसका responsibility है? Primary health center का. Which vaccine administered to a 10-year-old boy attending a school? DT and TT. Culture plate is disposed in which bag? Yellow bag. One bag wala question aega, without that there is no paper. A study was conducted on 30,000 women where researchers found out that there is a relation between C-reactive protein and stroke. What is this called? Positive correlation. Right? I am reading, my roommate is reading. I am more reading, my roommate is more reading. That is positive correlation. I am reading, that stupid fellow is crying that I am reading. That is negative correlation. So increase in CRP with increase in stroke is positive correlation. 55-year-old from Chhattisgarh, progressive muscle weakness, stiffness and pain in both legs. On examination, pure motor paralysis is being found. So what is the further history would you take? History of diet. So always laterism. One question on adulteration aega, doctor. Epidemic drop. See, laterism. Where do you find sanguinarin, argemone oil, then bova? Where will you use vitamin C? All those things in preventive medicine. So पूरा preventive medicine को हम 60 pages notes में खत्म किया, including biostatistics, only 60 pages notes. Please take every opportunity to do the revision, doctor. So brightness of the point source of light is measured through candela. So once more, lux, lumen, Lambert, candela, preventive medicine में. You have to be 100% sure. How much noise you get, deafness, how much floor space should be there, how much should be the light, window side should be how much, mosquito side should be how much. That is called sleep promoting medicine, SPM. Now, for analysis of functioning of a health center, which is the most important for assessing clinical management? Process, doctor, process. What is specialty of Britishers? Britishers are very good in process. For everything, process. If you want to, one of my cousin is a director of one of the great, biggest national bank. So he is maintaining 8.8 glycosylated hemoglobin. I told, array, metformin le rahe, it is not enough. You need to be added something else because you are maintaining 8 point. No, you don't know about the UK system. First, I need to go to GP. GP need to give a referral to specialist. But before GP gives referral, he will ask me to go to the diabetic nurse. That nurse says 2000 milligram metformin, but I am getting hyperemesis with every additional 500 milligram metformin. You are the director of one of the biggest bank and bloody you are much poorer than the auto rickshaw puller in Hyderabad. Here, medical shop Sino will give you. शुगर नहीं कंट्रोल हो रहा है क्या? अच्छा ठीक है, ग्लिबेनक्लोमाइड ट्राई करो, एमरिल 1 milligram, एमरिल 2 milligram. Your kidney failed or no failed, he doesn't look. If you like to take a shot, there are some new insulins came in the market. Ting tong, istemal karo hamara insulin. Anything you can do in India, not in UK, right? So post flood in Pathantitta district of Kerala, fever syndrome, doxycycline along with chemical poison spray. What is that chemical which is used as Paris green? Paris green is copper or acetoarsenite is emerald green. Emerald green is a stomach poison. It kills mainly anopheles because they are the surface feeders. Bottom feeder larvae are also killed, right? With a special granular formulation. So, acute encephalitis syndrome cases are reported in Gorakhpur. Health team decides for mass vaccination, which comes under universal immunization program. What is that vaccine and what is its route? It is Japanese encephalitis. So, it is a live attenuated subcutaneous vaccine. New Delhi reported the following air quality index. You know how much is the air quality index in Hyderabad? 148, 152, like that it keeps fluctuating. If it is less than 100, it is good. Right? Up to 120, it is considered to be hazardous to the sensitive group. AQI, air quality index, color coding of the AQI is a favorite question. मगर दिल्ली में क्या होता ना, आपको वेरी सीवियर रहता है रेगुलरली. So that is the reason Delhi teachers come to Hyderabad to start coaching program because Delhi में pollution high, right? So what is the conditioning factor for malnutrition? Malnutrition, a man-made disease, infections, right? Infections lead to malnutrition, malnutrition proposes infections. इसको क्या बोलते हैं मियाँ? वजन के लिए क्या करते हैं? Kata. This is called kata thermometer. Even if you want to become tomorrow a neurosurgeon, you have to clear this level. काटा थर्मामीटर क्या होता है, स्लो सैंड फिल्टर में स्लैंड पार्टिकल कितना होता है, वर्स्ट देन दैट सेप्टिक लैट्रिन का डेप्थ कितना होता है. छी, you need to read all the sleep promoting medicine, right? So kata thermometer measures low wind velocity and cooling power. 34-year-old comes to OPD with a lesion around the neck. So this is pellagra. Kessel's necklace. A female child has history of recurrent yeast and respiratory virus infection since the age of 3 months. Which vaccine is contraindicated? Which is live attenuated vaccine? In this, the only live is MMR. Rubella. International Food Policy Research Institute calculated global hunger index. So, which will not be used out of this in calculation? AMR is not included. Child mortality, child undernourishment, child underweight, they're all the part of the calculation of global hunger index. It is undernourishment, child weight, and mortality. 25-year-old woman has been taking OCPs, gave history of 4 missed pills in the last 7 days. Next line of management is take the next pill as soon as possible and consider barrier method if had intercourse in the last 72 hours. So all these protocols of emergency contraception, regular contraception, entrance is not for 200 but only 198 because 2 questions come from contraception. Patient with inguinal buboes, multiple buboes, what is the vector? Bubonic plague, Xenopsilla chiopis. 56-year-old, recurrent retrosternal chest pain. ECG shows LVH with STT changes with T-wave flattening. What is the next step? Now he presented with, he is a known case of hypertension, diabetes. Why NTG? He is not having any accelerated hypertension, no. You need to start him on low molecular weight heparin, right? So since there is STT changes and T-wave flattening, it suggests the patient is having unstable angina. For unstable angina, low molecular weight heparin. What is MONA? O for oxygen, N for nitrates, A for aspirin, M for morphine. These are all the part of the treatment of MI, ischemia. 30-year-old with weight of 70 kg is admitted to multiple episodes of seizures. Serum sodium is 120. How do you calculate sodium deficit, doctor? Very, very, very simple. Sodium is principally in intra or extracellular fluid? Extracellular fluid. So what percentage of the human body weight is water? ECF 60%. So 70 kg वाले में 60% क्या हो गया? 42. So 42 liters of ECF is there. So you have 120. What is the normal weight? Normal sodium 135. Okay. 135 minus 120 is कितना हो गया? 15. 15 milliequivalents for every liter. So 42 liters के लिए 15 into 42 कितना हो गया? 630. 630 milliequivalents you need to give. Suppose if you give normal saline contain 154 milliequivalents per liter. You need to give 4 liters of normal saline, which is 8 saline bottles चढ़ाना पड़ता. 4 liters देना पड़ता है 630 के लिए. But if you give 3% saline, 3% saline will have 514. That means just hardly 1 liter is enough in one day to bring it normal. So that is how you calculate. Okay? So, but in this case, 630, na? 630 bole to aaju nearby to 840. इसने 140 कंसिडर किया. A female patient with hysteria, hyperventilating, developed pH 7.53 alkalotic and PCO2 of 20, bicarb is 26. What is your diagnosis? Metabolic PCO2 taggindiga. Respiratory alkalosis. Metabolic alkalosis means this should be very high. A patient is experiencing respiratory alkalosis. What is the classical sign? Come on. अरे ऐसे चीजों को भी आइंस्टीन मेरी क्यूरी के लिए सोचे तो कैसे विनिशा? Don't become Mary Curie for this kind of questions. See, alkalosis pH is high, correct? pH is increased. So fundamental. ఏమిటిది? అయ్యో दीक्षा, प्रिपरेशन फॉर एंट्रेंस के लिए कुछ लोग अमीबा स्टेज में रहते हैं, कुछ लोग एनीलिडा, कुछ लोग आर्थ्रोपोडा कॉकरोच लेवल पे रहते हैं, कुछ लोग मोलास्का लेवल, कुछ आर इन फिश, कुछ आर इन, कुछ लोग, कुछ स्टूडेंट्स birds, aves, mammals, tail will appear. For few people orangutan, finally homo sapien. आप कौन से लेवल में है बेटा? प्रिपरेशन में दिख रहा है कि इसका आंसर मालूम नहीं बोले तो आप कुछ आर्थ्रोपोडा एनिलिडा लेवल पे हो. स्टैंडर्ड क्वेश्चंस, एसिड बेस डिस्टर्बेंसेस, लिटिल सिंड्रोम, बार्टर सिंड्रोम, जेंटलमैन सिंड्रोम, रीनल ट्यूबुलर एसिडोसिस, कॉन सिंड्रोम, कुशिंग सिंड्रोम. సరే ఇప్పుడు చూడండి, pH ఉన్నది కదా, इसलिए मैं क्या बोल रहा हूं ना, द 1200 pages notes, you don't need video for everything. Kaushik, don't read video, quickly run through. Where you feel like doubt, just go to video, otherwise it will waste. Videos are waste, they will slow you down. Not only me, any teacher teaches videos, they're only good in the live class. Recorded कंटेंट इज बकवास है. एक जमाने पे कोई भी इतना लाइव अवेलेबल नहीं है, उस जमाने वीडियोस आर ओके. टुडे वीडियोस आर ए डस्टबिन. सो ओके, लेट्स कम टू द पॉइंट. pH, if it is high, then what will happen to the negative charges on albumin? Increase, and your calcium will become more bound with this negative charges. Anytime pH is low, negative charges will become decreased. Whenever pH is high, negative charges become more and calcium become bound. Free calcium is low. That lead to hypocalcemia. Hypocalcemia lead to tetany, Chowstek sign, everything. Right? You said the same thing? Huh? I'm sorry, थोड़ा issue है. So, 30-year-old behaving strangely developed a episode of seizure. Urine osmolality is 1000, plasma osmolality 20. What is the dyslipidemia present in this case? Urine osmolality is high, plasma osmolality is low. That means more water is reabsorbed into plasma. So that means it is what? SADH. एंटीडायरेटिक हार्मोन. एसएडीएच में क्या होता है? हाइपोनेट्रीमिया होता है. एसएडीएच में हाइपोनेट्रीमिया क्यों होता है? So whenever ADH is causing water retention, what happens to plasma volume? Increase. That will cause the stretching of atria. Stretched out atria release atrial natriuretic peptide. That will go to the kidney and make sodium lost into urine. So that is the reason urine sodium is more than 20 for you to define it as SADH. And plasma sodium is low. Along with urine osmolality, high. Plasma osmolality, low. That is the combination. Okay. Now, doctor, a child is born with congenital hydrocephalus, with BP shunt, irritability, tiredness, fever. Rectal thermometer showed a value of 38.4. What is the next step? Blood culture from peripheral blood and CSF sample by the tap of the BP shunt reservoir. So typically fever, irritability, everything as indicative of shunt infection. 30-year-old moderate headache thrice a week. She says that recent 6 months she stopped using the medication and her headache has decreased. So what medication it is? Medication overuse, headache. Which headache is common in male? Beautiful. Which headache require oxygen inhalation? Which is tight band-like headache? Oh, tension headache. Which headache may patient says, oh my God, the flesh in my eye is being torn out. Cluster headache. Which headache has got rhinorrhea and all the features of autonomic hyperactivity? Good girl. छोड़ दिया. Headache पढ़ना, headache नहीं पढ़े तो गब्बर आएगा. Elderly diabetic. Am I too fast? Multiple, am I too slow? Okay. So, ये आदत बन गया मेरा. So, am I too fast or too slow? Feedback is required for every teacher. It depends upon what kind of students are sitting in class. So pH is 7.5, PCO2 is 45 elevated, and bicarb is 30, sodium is 130, potassium 3.5, chloride 90. Any protracted vomiting lead to low plasma volume, decreases renal plasma flow, increases the renin-angiotensin, aldosterone. Aldosterone will cause sodium retention, potassium loss, and metabolic alkalosis. 50-year-old presents with nocturnal cough, breathlessness, wheezing episode. Once more, entrance is not for 200, but at least 2 questions will come from acid-base disturbances. 2 questions come from dyslipidemias. वो तो दस्ती डाल के बैठ गया वो टॉपिक्स. दूसरे टॉपिक्स को बैठने नहीं देते. उतना शूट शाट है. बराबर? So, you promised, Diksha, I will put all the very, very hot topics in WhatsApp में लिस्ट डालता हूँ. बोले होमवर्क लिस्ट नहीं डाल रहे आप. अम्मा आप अपने आप रिंग बना रहे. नहीं पूरे दुनिया को बोलो. वो बोलेगा कि दीक्षा का लिस्ट है. राइट. Knowledge grows when you share. Absolute eosinophil count is 5,000. Huh. So, what do you see here? Wheezing episodes. Tropical pulmonary eosinophilia. This is the miliary pattern. So, there is a criteria for calling tropical pulmonary eosinophilia. Absolute eosinophil count more than 3,000. Serum IgE levels are elevated. Serum antiviral antibodies Ig and IgG are positive. Paroxysmal nocturnal cough and breathlessness will be there. They are all the various criteria. 25-year-old with mitral stenosis with irregular pulse. Epa? Why not bronchial asthma? Bronchial asthma, why do you get miliary pattern of the radiogram? Yaji. Regular question hai. 25-year-old with mitral stenosis, irregular pulse means atrial fibrillation. So you need to start on warfarin. CKD patient lands in uremic encephalopathy. What will you see in CKD? Acidosis. Metabolic acidosis. Metabolic acidosis, not a respiratory. High anion gap metabolic acidosis. ఎన్ని క్వశ్చన్లు వచ్చినాయి యాసిడ్ బేస్ డిస్టర్బెన్స్ ఆల్మోస్ట్ 3-4 3 to 4 questions came on acid base disturbances. So same way will be the tomorrow's NEETPG also, no big deal. After finishing all the 70 grand tests, you will say पढ़ना क्यों सर, सुनना काफी है, मगर attempt करके आना. Grade 4 CKD with GFR less than 30, doctor wants to prescribe thiazide. Metalazone, I told you, when renal plasma flow is very low, metalazone is still effective. It's a loop diuretic. A loop diuretic always is more powerful than thiazide. Patient has history of vomiting and doctor gave antiemetic and developed motor symptoms. What is this called? Extrapyramidal syndrome because of the dopamine depletion caused by metoclopramide like drugs. So in that case, how do you treat? You need to give drug like benzhexol. Benzhexol. So fundamentally, there is a fight between what? Dopamine and acetylcholine. अगर dopamine कम हो गया तो that led to extrapyramidal symptoms. So you need to give a drug which will also bring down the acetylcholine level. Like benzhexol is what you need to give in that case. 65-year-old male with excessive tiredness, ptosis, difficulty mastication, end of the day. Who is the famous actor? Big Boss. 35-year-old, temporal headache, arm claudication, femoral pulse is weak, Takayasu, pulseless disease. 50-year-old chronic alcoholic, drinking history of 20 years, jaundice, ill sclera, octreotide plus albumin. So this is called what? Hepatorenal syndrome. क्या होता है बेटा? Once more लिख लो. Favorite topic of examiner, hepatorenal syndrome. इसमें type 1, type 2 होता है. Hepatorenal means kidney has no abnormal pathology. Kidney failure is because of fundamentally liver pathology is called hepatorenal. When do you call hepatorenal? Kidney is normal in histology, but kidney failure is secondary to liver. So it is a functional renal failure without renal pathology that occur in 10% cases of advanced cirrhosis. Whenever large amount of ascites is there is a stepwise increase in creatinine. In this you have type 1 hepatorenal, where there is a progressive impairment of renal function with reduction of creatinine clearance within 1 to 2 weeks of presentation. And type 2 is fairly stable and has a better outcome than type 1. So the best therapy for HRS, this is a favorite MCQ. The moment a patient of cirrhosis of liver goes into HRS, the treatment is liver transplantation is considered to be the treatment. Very good to see 16 online classmates. 10-year-old child, recurrent pulmonary infection, bulky stools with fat more than 10. Inka em kavale? Pulmonary infections, so bulky stool, steatoria. Chepandi, jaldi. Ayyo. What is your answer, Diksha? Cystic fibrosis, pa. Em confused? మళ్ళీ నువ్వు ఎందుకు నేను కన్ఫ్యూజ్ చేస్తే నువ్వు మారుస్తావా? మంచిగానే ఉండవు. కన్ఫ్యూజ్ చేసినా, ఇన్ఫ్యూజ్ చేసినా, ట్రాన్స్ఫ్యూజ్ చేసినా అదే ఆన్సర్ ఉండాలి. థిక్ సెక్రీషన్స్ విల్ ఫార్మ్ నా పల్మనరీ ఇన్ఫెక్షన్స్. Cystic fibrosis also lead to steatorrhea, malabsorption. Why malabsorption? Why steatorrhea in cystic fibrosis? ఎందుకు స్టియటోరియా అంటే ఫ్యాట్ malabsorption ఆఖరికే. స్టియటోరియా ఎందుకు ఉంటుంది? ఇప్పుడే చెప్తాను. అమీబా లెవెల్ ఉన్నవా, ఏ లెవెల్ ఉన్నావు వినీషా చెప్పు. Cystic fibrosis may thick secretions infect which organ, which produce a lipase, which is required for the fat absorption. ఇక్కడ ఏమున్నది? స్ప్లీను, ఇక్కడ లివరు, ఇక పొట్టలో ఏముంటాయి చెప్పు? పాండ్రియాసు, intestines. What does pancreas secrete? Pancreatic lipase. Because of the thick secretions, pancreatic duct is blocked. So no lipase is entering gut. That's the reason it leads to fat malabsorption. Fat malabsorption. The reason is pancreatic insufficiency caused by cystic fibrosis. A male patient noted to have weak femoral pulses, upper limb BP is high, means what is your answer? Very good. Intercostal increased pulsations, wo bhi hai na? Isliye coarctation of aorta, because of the collaterals. అందుకనే ఉన్నారు హైపర్ టెన్షన్ అనగానే, వీక్ ఫిమరల్ పల్సెస్ అనగానే దూకుడే. Pulselessness is a feature of Takayasu, but here you have intercostal pulsations now. CKD patient presented. What do you see in the ECG? Arjun, Bolo Arjun, Dronacharya ko. Tall T waves hai Guruji. इसलिए ये क्या है Guruji? Hyperkalemia. 10-year-old girl with myoclonic jerks. Class teacher complained about lack of concentration, poor performance. There was a viral exanthem at 2 years of age. What is this called? Burst suppression pattern. Burst suppression pattern, which is typically seen if there is a subacute sclerosing panencephalitis consequent to measles. Measles mein there is an entity called entire brain white matter destroyed. That is called subacute sclerosing panencephalitis mein burst suppression pattern. Anti-measles immunoglobulin antibody in CSF. 50-year-old comes to hospital with chest pain. Angiogram shows left circumflex occlusion. Atorvastatin, aspirin, metoprolol was started. Which statement is correct regarding further management? You also need to add the P2Y12 inhibitor group. What is that? Clopidogrel. So there are two types of antiplatelet medication. What is that? Only aspirin or double antiplatelet means what? Aspirin plus clopidogrel. Clopidogrel mechanism of action is basically P2Y12 receptor blocker. Patient presents with numbness, color changes in the fingertip, ANA positive. What is this immunofluorescence pattern called? Come on, doctor. Earlier we had this. They will also have Raynaud's phenomena. Systemic sclerosis, puckering of the face, skin tightness, shawl sign, V sign, all signs, nuclear pattern. It is called as in systemic sclerosis. See, these are all very standard, doctor. There is nothing surprising about it. Jaiswal क्या हो गया? Jaiswal नहीं आ रहे? सुरेश को जब मंसिल नहीं था. Rheumatology, Diksha, simple. SLE. mixed connective tissue disorder, rheumatoid arthritis, vasculitis, systemic sclerosis, dermatomyositis, polymyositis, Sjogren syndrome. You can count on your fingers. Pura rheumatology, I finished a discussion in not more than 25 pages, 20 to 25 pages. कितना देर लगेगा 20-25 न्यूज़पेपर के जैसे पढ़ो, right? So it's all first time. It looks like a wonder. After that, it is nothing. Hematology, leukemias, lymphomas. Only challenge is remembering the CD markers and all that. Then hairy cell leukemia, AML, ALL, CML, CLL, hemolytic anemia, paroxysmal nocturnal hemoglobinuria, aplastic anemia, then multiple myeloma like conditions of bone marrow, polycythemia rubra vera. So the entire spectrum of hematology, 30 pages notes है. एक मर्तबा गिरनी में लगा के घुमाओ 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 घुमाओ. All the video is available on the Score app. But every time, no, you keep postponing. No end. See, at least कल जो wrong किया है आज better होना है. कल तो हम ए पैटर्न के बारे में पढ़े ना. You remember one of the MCQ came in the recent mock test that we have discussed. Different patterns, nuclear pattern and all that. Revision, yeah. Don't aim too high. Just to say, by this week, every day can I finish 5 topics? And at least 10 pages per day revision in the Murli Bharadwaj Score app notes. You become better. Next week, do every day 10 pages revision. Next week, 20 pages revision. Slowly improve. पहले दिन ही आप 5 kilometer marathon बोले तो body should be ready now. Right? So slowly you will improve. 68-year-old with cough and sputum, bronchial breathing, scattered crackles, urea 44, which is, what is the treatment protocol? So CURB. What is CURB criteria to do admission in a case of pneumonia? Confusion, urea increasing, respiratory rate increasing, blood pressure systolic less than 90, diastolic less than 60, age 2 to 65 years. This is CURB 65 criteria. So, typically, hospitalization is not necessary depending upon the score. Pneumonia, CURB score. And also, finish reading. ARDS is one topic. A patient with giant cell arthritis with history of headache, jaw claudication, polymyalgia rheumatica, how do you want to treat? Methylprednisolone. If you don't start methylprednisolone immediately, even without waiting for the results of the temporal artery biopsy, if you don't start, blindness develops. So methylprednisolone should be started. 55-year-old undergoes modified radical mastectomy 3 months back for breast cancer. Now she developed a painless swelling in the left upper limb. So this is classically lymphedema after mastectomy. Total thyroidectomy. Anesthetist tried to extubate. Patient was unable to extubate. What is the reason? Thyroidectomy mein bilateral recurrent laryngeal nerve palsy unte, then he will never come out of that obstruction caused by the vocal cords paralyzing. About pheochromocytoma patient, pheochromocytoma. First to start, what is the rule in pheochromocytoma? Before beta blockers, what you should start? Alpha blockers. Enduku. First beta blockers, enduku. Why this kolavaridi? Typically, pheochromocytoma has high catecholamines. High catecholamines are causing accelerated hypertension. To treat that, don't start beta blocker, because if you start beta blocker, then alpha receptors are available. Entire catecholamine will go and bind with alpha 1 receptor. Alpha 1 receptor lead to intense vasoconstriction. So that is the reason, try to give combined, or you try to give alpha first, then followed by beta blocker. A 50-year-old with colicky abdominal pain with bilious vomiting, what is the most probable diagnosis? Gallstone ileus. Beautiful. Because there is a gas in the portal, we know it is passing through that. 45-year-old with obstetric jaundice, CVD stone, history of cholecystectomy, done 2 years ago. What type of stone you call that as? Retained stone. Retained versus recurrent stone. We already discussed this differences. 40-year-old with emergency acute abdominal pain, fluid-filled lesion is present in the epigastric region. So which parameter? Pseudopancreatic cyst, if it is there, lipase is the one which is elevated. 60-year-old male presents to hospital, mainly here is what a description of the lesion. 40-year-old presented to emergency with acute abdominal pain and distension. Now, 60-year-old presented with gastric outlet obstruction, antral gastric carcinoma extending to the pancreas with multiple metastases to right lobe of the liver. How do you want to manage that? Palliative gastrojejunostomy with chemotherapy. So multiple episodes of non-bilious vomiting means gastric outlet obstruction. Hypochloremic, hypokalemic, metabolic alkalosis, which is also seen in congenital hypertrophic pyloric stenosis also. Patient presented with emergency, pain abdomen and fever for 3 days, dehydrated face, abdominal X-ray is being shown. What is the most probable? Actually, that was showing pneumoperitoneum, gas under diaphragm. Hence, it is a hollow viscous perforation. 55-year-old underwent hysterectomy 2 years back. Now with colicky abdominal pain and bilious vomiting. Exaggerated bubble sounds, abdomen is tender. What is the diagnosis? What do you see here? Air fluid levels, which is suggestive of small intestinal obstruction. Centrally located air fluid levels. So adhesive small bubbles, because previous history of surgery was there, no, that led to injury. A 45-year-old male patient with paralysis operated for rectal prolapse as shown in the image. So what is this? Complete rectal prolapse. So for this, what do you do? Pierced wiring. You'll be doing pierced wiring after pushing it back, right? And post wiring, it looks like this. So this is complete full thickness rectal prolapse receiving pierced wiring. 54-year-old right groin swelling below the inguinal ligament, medial to inferior epigastric artery is what? Direct hernia. And how do you repair? Lichtenstein's repair. Once more, inguinal, femoral, rupture, then what else? Lumbar triangle of Petit also herniation can occur. Incisional hernia, umbilical hernia. One hernia, without that, there is no NEETPG exam. The patient is on of road traffic accident, left frank blues, hematuria. What investigation need to be done? CECT. What is the preferred treatment option for 85-year-old with Gleason score of 6, 2 into 3 centimeter nodule, level of PSA is 8. So when to do TURP, when to do radical prostatectomy, when to do active surveillance and follow up. You need to be very sure, doctor. 10-year-old boy skids while cycling. Child was stable. Abdominal examination was normal. Blood noticed at the tip of meatus. What do you want to do? Never do Foley catheterization if you are suspecting bulbar urethral injury, because if it is a partial tear, you complete tear and you finish the God proposed, man disposed. 26-year-old operated with redness over the perineal area. Post-operative day 5 image was being shown to you. What is this, doctor? Fournier's gangrene. It is caused by mixed aerobic and anaerobic infection. 35-year-old HIV positive patient, she presented with a claudication of the right thigh after was given ergotamine. So it is a case of ergotamine associated vasospasm. So she required stunting. 45-year-old asymptomatic varicose veins. You are able to see the varicose veins, right? So there is a classification called CEAP classification. So what is CEAP classification? Class 1 means only telangiectasia. Class 2 means visible varicose veins. Class 3 is edema. Class 4 is pigmentation. Class 5 is healed ulcer. Class 6 is venous ulcer. This is the CEAP classification for the development of for the patient. This is telangiectasis, varicose veins, edema, pigmentation, healed ulcer, and this is a chronic ulcer for chronic venous disease, CEAP. 64-year-old underwent CABG. Graft taken from saphenous nerve, vein. Which nerve will be affected? Saphenous nerve will be affected. 80-year-old presented with fatigue and pallor with pure red cell aplasia. And what do you see here? Anterior mediastinal mass. What are the 4 T's you need to remember among anterior mediastinal mass? T for thymoma, T for teratoma, T for retrosternal thyroid. Are the T's you need to remember for anterior mediastinal mass? So thymic neoplasia. Right? Cerebral lymphoma, retrosternal thyroid, teratoma, and thymoma. 4 T's about anteromedicinal mass. 25-year-old presented with history of road traffic accident. Patient has subcutaneous emphysema. No air entry on the right side. Hypotension. What is the next step? Do a needle decompression into 5th intercostal space. 25-year-old male presented with alleged history of road traffic accident. At the time of presentation, systolic BP was 70, pulse rate was 110. What do you want to do? Fast. We'll quickly take 2-minute voice break. Wow. I'm so happy to see a quarter century of students, sir. Always teachers are happy to see students in the class. Of course, we have 150 students here. So, every day, morning 10 o'clock, score app, new test is published, doctor. Solve the paper, afternoon I will come, we will have a discussion. Totally 70 grand tests with the discussion, with explanatory answers, PowerPoint, video, everything available in the score app. And these 15,000 questions that we are discussing in this 70-75 tests, sure shot, all 200 will come, 100%. So every day keep filling 4 or 5 topics, then you will become better. We'll finish 10 more questions and take a break because we have a crowd means teacher has more energy. Pregnant lady, can the online students can punch whether you are able to listen, doctor? Today only please download, go to the Score NEETPG app. This is what you hit in the Google. you'll get the Score NEETPG app. Sir, Ashwini is asking, sir, is it available for all or only for subscribed ones? It is obviously available for subscribed ones, no doubt on that. About all, बीच बीच में हम ऐसा यूट्यूब में एडवर्टाइजमेंट के लिए फ्री में देते हैं. हम तो महात्मा नहीं हैं, हम तो सर्वाइव होना है. So please do subscribe, Ashwini. And if you subscribe, you will also get 1200 pages notes covering all 19 subjects. You also get 600 hours of video content. You have 40,000 MCQ question bank with topic-wise analysis of the areas of your strength and weakness, subject-wise. In addition to the mock test, daily live class, everything. So good to see Bharat. Bharat today missed in the 150 student class here. He's watching from the home, right? So Bharat, please do come tomorrow. So every day we have a test for the next 70 days, doctor. Now, a pregnant lady has history of delivering twins. If she is pregnant for the second time now, what do you call her as? G2 gravida, one para, two living subjects. Lady with history of recurrent abortions means antiphospholipid antibody syndrome. 28-year-old married woman complains of profuse white discharge. No history of itching means physiological. 18-year-old with partial transverse vaginal septum presents with dysmenorrhea, chronic pelvic pain, endometriosis. Remember, NEETPG is not for 200, but one cervical cancer, one ovarian cancer, one endometriosis, one endometrial cancer, one question on infertility, one question on 5 infections, right? One question on prolapse, like that, all 30 questions, you can predict it. Totally, I have given you around 35 pages notes in gynecology and around 25 pages in obstetrics. This पूरा 60 pages में पूरा दुनिया है. So revision कर लेना. Now, doctor, what is the least common? So Ashwini and everybody, you can WhatsApp 900868 you will get the subscription. Otherwise, you can directly even pay through Google on the Score app. Now, what is least common in didelphys uterus, doctor? Abortions, transverse life, preterm labor, everything is common. One more topic. Mullerian anomalies. Short question. 32-year-old pregnant woman with infraumbilical flattening, fetal heart rate, heard in the left flank. What are the cause? Classical occipito-posterior occasion. So how do you identify? Normally when vertex is presented, occipit is supposed to be occipit is supposed to be under pubis or over sacrum. Baby will be born like this, like this. So reverse is occipito posterior, right? Now 28-year-old, 36 weeks, painful vulvar lesion which is being shown to you. So what is this? Vesicular lesion, which is herpes. So acyclovir electris Caesarean. 32-year-old presented chest X-ray is being shown to you. What are they called? Cannonball metastasis, which is seen in choriocarcinoma. So that is the reason single agent chemotherapy like methotrexate. Definitely, one question comes from twins, one question comes from molar pregnancy, one question comes from antepartum hemorrhage, one question comes from abortion. Hayyo, there is nothing more predictable than gynops and the newly married husband after honeymoon. These two are most predictable things in the world, right? When will he be angry? When will he cry? When will he be disappointed? When will he be nosy? उतना स्टैंडर्ड होना है प्रिपरेशन 25-year-old primary gravida giving birth to a child, continuous bleed from the uterus, plan for uterine devascularization. What is the order? Uterine artery, ovarian artery, interiliac artery, worst case. 34-year-old using OCP since 5 months, presents with amenorrhea since 6 weeks. Crown run length by ultrasound is very precise depending upon her age of gestation. 25-year-old female with primary infertility comes with uterine anomaly. How do you prove it? Hysteroscopy and laparoscopy. 25-year-old with midline septum of uterus. What is the management? Histoscopic septoplasty. 55-year-old multigravida with history of frequently micturating when laughing means stress incontinence. One more topic: stress incontinence, urge incontinence, overflow incontinence. Sure, short topic. This on ultrasound, left neck cell mass, beta HCG is 2800. Small gestational sac and fetal pole, but not fetal heart action is seen. Depending on the size of the mass, medical or surgical, medical management. So what do you use for medical management of ectopic? Methotrexate, day 1 injection methotrexate, get day 4 beta HCG, 7th day beta HCG, right? Then when do you do surgical indications, contraindications, everything we discussed in our regular notes. Now, doctor. Bharat is asking, sir, is transverse lie, is it not possible? I think he got the answer. Why not it is transverse lie? Earlier, osteoposture was there, no? I told you, no, how do you identify osteoposture? Lady with primary infertility, 2 uterine fibroids in carnal area. On hystosalpingography, it is found to be blocked. So what is your management if you are told that woman is ovulating and semen is normal? Remove that predisposing factor, myomectomy. So 25-year-old with paronychia and there is lymphangitis, ascending lymphangitis. What antibiotic you want to give? Always amoxiclav. Very, very, very effective for treating lymphangitis. 30-year-old flaccid bulle, crusting of the skin, mala. Sure short topic क्या है? Bullous pemphigoid, pemphigus vulgaris, dermatitis herpetiformis is like a prescription. Examiner is going to ask. So biopsy revealed suprabasal split. What is that called? Tombstone appearance is seen in vulgaris. Multibacillary MDD therapy presented with inflammation edema of a pre-existing lesion. So all lepra reactions, type 1 lepra, type 2 lepra, erythema nodosum, leprosum, how do you manage that? Everything you should know. So whenever recurrent erythema nodosum, leprosum is there, steroid plus clofazimine for 3 months, taper the steroid clofazimine for 3 months, stop steroid, only clofazimine for 3 months is the prescription. Male child with mild painful swelling of the scalp for 3 months. Patient had a dog pet in the home. What is this? Carry on. Come on, Vinisha. Carry on. One question compulsory on dermatophyte infection, doctor. You can't escape. Alopecia, which is scarring type, what is non-scarring type, where do you see exclamation mark, what is telogen effluvium, they're all pakka topics in NEETPG. ఎందుకు అనుకున్నావు కాదని ఫస్ట్ అనుకుంటే సెకండ్ కూడా అనుకోవాలి ఆఫ్టర్ కమింగ్ అవుట్ ఆఫ్ ఎగ్జామ్ హాల్ ను image based questions may, if you can answer without seeing image, then you are correctly answering. If you are seeing image in exam hall and trying to answer me, generally you are wrong. It should come at the level of cauda equina answer. Your cerebral cortex, limbic system, mammillary bodies, वो सब काम नहीं करना exam hall में. पूरा cauda equina should be dancing. 1 hour में खत्म करके बाहर निकल. Endotracheal intubation was done. How do you know good ET tube placement? End-tidal carbon dioxide. The patient is undergoing surgery for anesthesia maintained on halothane. He developed muscle rigidity. Succinyl choline lead to malignant hyperthermia. Which receptor? Diksha? Malignant hyperthermia. Which receptor in sarcoplasmic reticulum is abnormal? Which is excessively releasing calcium, which is causing all that. చెప్తావా నువ్వు చెప్తావా నువ్వు కూడా చెప్తావా ఏ రిసెప్టార్ మ్యాలిగ్నెంట్ హైపర్థర్మియాలో అబ్నార్మల్ ఉంటుంది ఏ భరత్ చెప్పా ఎవడు ఆన్సర్ చెప్తలేడు భరత్ వాట్ ఈస్ యువర్ ఆన్సర్ పంచ్ ఇట్ వాట్ ఈస్ ద రిసెప్టార్ అబ్నార్మల్ ఇదొక డ్రామా చెప్పు ఆర్ ఫర్ ఓకే RY RYA RYAN ఈయన ఇంతకంటే భరత్ నువ్వు గిట్ల చేయక అన్నాడు సోడియం ఛానల్ రిసెప్టర్ అట మెలిగ్నెంట్ రైనోడైన్ రిసెప్టర్ పెట్టి అమ్మ భరత్ కరెక్ట్ చెప్పాడు రైనోడైన్ పరువు కాపాడినావు భరత్ జిందాబాద్ సో డాక్టర్ one question comes on advanced and basic life support ఇది చెప్పాలి మా ఎమర్జెన్సీ డాక్టర్ అని చెప్తుంది head tilt chin lift tongue blocks the airway to open airway head tilt chin lift anesthetic was doing shoulder block with bupivacaine patient became unresponsive pulse became unreportable what is the best management CPR with 20% interlipid emulsion. Last layer to be pierced while you are entering lumbar cisternae is arachnoid matter. So what are the layers through which spinal anesthesia passes? Skin, subcutaneous tissue, supraspinous ligament, interspinous, ligamentum flavum, dura matter, arachnoid matter, then subarachnoid space. Abdominal pain and distension. Multiple air fluid levels. Dilated loops are seen. These are jejunal loops. But here, once more, how do you differentiate jejunal from ileal versus? What is called characterless cecum. Cecum doesn't have a character. Right? So how do you identify based on what are these? Conniventous, right? So anyway, in radiology ek martaba review karenge. 30-year-old with sterile pyuria. So what is this calcified putty kidney which you've seen in TB, right? Child has prophylactic irradiation, bone marrow transplant for the treatment of ALL. What is affected least? Prophylactic irradiation la neurons. They are most non-replicating. Why will they get affected? Child with cyanosis presents with what is this appearance called? दिख रहा है क्या? Figure of 8. So snowman's అదే దాన్ని అంటారు. ఏంటి కండిషన్ ఏంటి? Anomalous pulmonary venous circulation. So what is meant by anomalous pulmonary venous circulation? So pulmonary vein draining into left atrium, it drains into right atrium, into which even the SVC, IVC are draining. So right and left pulmonary veins combine to form common pulmonary vein, and that drains into the right atrium. In the process, they form figure of 8. Right? This is the typical figure of 8 or snowman appearance, you call it as. Then what do you get in transposition of the great arteries? Transposition of the great arteries. Right and left drain into a common thing. Yeah, I mean, right ventricle drains into aorta and left into pulmonary artery. So, sorry, truncus arteriosus means not transposition. Truncus arteriosus means between pulmonary artery and aorta, septum gone. So both of them are draining into common trunk. There, this is called cotton loaf appearance. It's like this one ventricle, above that you are having the common truncus. Cotton loaf. This is what? String on, agon string. Agon side of string. Where does this happen? Transposition of great arteries. Normally there is a very prominent aortic curve. The moment transposition occurs, that prominence provided by the aorta will be gone. So that's the reason it looks like a string. ये तो आपको मालूम है. Core and sabot. Where what is this part which is being lifted up? Right ventricle or left? And what is the favorite question of Murli Bharadwaj sir? Every time he asks, prognosis of TOF depends on. Is it on the transposition? Is it on the, is it on the overriding aorta? Is it on the VSD or is it on the pulmonic stenosis? Which decides? Prognosis of TOF depends on how many lesions you have. Right ventricular hypertrophy, VSD, pulmonic stenosis, overriding aorta. PS decides the prognosis. Okay? Is he going to live longer, die? Second, you listen a systolic murmur. It is not the murmur caused by VSD. The systolic murmur of TOF is caused by PS. Because VSD is a very low flow VSD. It is the PS which lead to systolic murmur. By chance, if you tell the examiner, no, what is the cause of systolic murmur in TOF? VSD, Gran. It is PS. Who decides prognosis? PS. చెప్పుకున్నాం కదా మళ్ళీ అడుగుతలే ఇంకొక 60 రోజులు నేను అది గుర్తులేదు బాగానే బిఎస్డి తనేం చెప్పలే తను ఫేవరెట్ పిఎస్ అని చెప్తుంది అది చెప్పదు రైట్ రైట్ ఆ రోజు గిరిజాకు ర్యాగింగ్కి అమ్మ రైట్ రైట్ వెరీ గుడ్ శోభియా అఫ్రోజ్ ఇస్ సెయింగ్ pulmonary stenosis. Very good. Even Bharat said pulmonary stenosis. Bharat is a gold standard for us. Patient presents chronic ear discharge, headache, and ear pain. What do you get here? Temporal lobe abscess. So, what is the cause of chronic ear discharge, headache, and ear pain? What do you get here? Temporal lobe abscess. Temporal lobe abscess. So what is this normal hysterosalpingogram? This is 35-year-old male with hammer and chisel. You can't do him MRI because it's a metallic object inside. During course of psychotherapy, therapists get a mixed conscious, unconscious feeling towards patient. What is this phenomena called? Counter transference. Is called. So the doctor is the therapist, and the patient is telling that my husband is very bad. He beats me every day. Oh no, the doctor will fall in love with the patient. He says, forget about that stupid husband. I am there now. We'll both go together tonight. So that is called counter transference. That is, patient passed the empathy to doctor. The other one, the doctor is treating a highly febrile baby of the mother, a small baby who is having neonatal meningitis. She became completely dependent on the pediatrician. यही भगवान है, यही कुछ भी है, right? He is much better than my husband. My husband is a useless fellow. This pediatrician is the best fellow. That is what transference, right? So that is the reason, as clinicians, we should always be careful. We should not make patients' emotions become contagious on you. And of course, your good personality becoming contagious is fine. But if you keep a face of a Vichara Buchya, if you keep a sad face because your wife is very dangerous in the home, you will transfer that unnecessarily to patient. So even if there's a disaster in your home, carry a smiling face when you go to the patient. Chronic alcoholic decides to be abstinent. After 3 days, he has confusion, disorientation, agitation, hallucination, is delirium tremens. What is a formal thought disorder? Derailment. That is one idea, which in no time he will talk about completely different idea. 16-year-old female was brought by her family members. There is over familiarity, flight of ideas, elevated mood, increased sexual desire. That is called mania. Then Anganwadi worker takes weight of 4-year-old child and finds out that her height for age is less than 2 standard deviation. What is that called? Chronic undernutrition. Height is not acute. Height is not acute. Height stunting will occur only if it is a chronic nutrition. Oh, 1 minute. A 1-month-old boy, weight is 8 kg. This is the growth chart. So based on the growth chart, doctor, one question will come on the growth chart tomorrow also. How do you grade the malnutrition? Vinisha, what is your answer? Moderately malnourished. So it all is severe means 67%, 3 standard deviation. 78% is 2 standard deviation. 10-year-old child presented with webbed neck means inka malla chiller question, Turner. Deoxygenated blood back to the placenta, umbilical artery. 10-year-old generalized edema, serum cholesterol 238, urine protein 3 plus. What do you find? These are called fatty cash. Good pasture में hematuria रहता. Proteinuria ఎందుకుంటది వినిషక్క? అంతే. What are these called? Oval fat bodies. This is what lipid cache is a classical feature. Shanti, Shanti, Shanti. 2 hours, 30 minutes. తొందరగా అయిపోయిందా? Huh. So, once more, thanks to all of you for coming to the session. Next 60 days, lot of time, doctor, let me tell you. आज से शुरू करें तो भी you will get the catch up growth, right? Thank you.
56 days.
50?
6.
Huh.
Remaining only 56 days.
56 days, huh? Ayyo. 56 days के बाद I don't find Diksha coming to class. Huh? I don't want her to come to class also. I want to see her to becoming an emergency medicine doctor. No problem, Bharat. At least you late but latest arrival of you. At least from tomorrow, please do come because the brightest cream of Andhra Pradesh called Bharat from Usmania Medical College is what is most needed for this teacher to have energy.
No class for nursing students.
Hmm?
You are a nursing students in class.